The mental health charity MenCap calls it death by indifference, the disturbingly high rate of premature deaths of patients with learning disabilities in the care of the NHS. With the final report into the abuse of residents at the Winterbourne View care home being published on Monday, this programme has seen a report raising serious concerns about how the health service treats some of the most vulnerable people in British society. This exclusive report is by our health and social care correspondent, Victoria Macdonald.
Nikki Rawlinson was 26 when she died in her local hospital, and her family is convinced that her care was so poor simply because she had a learning disability.
Nikki couldn't communicate with the staff on the ward, she couldn't communicate with the doctors. And I think when Nikki was there on her own, when I wasn't there or friends and family weren't visiting, they were asking Nikki to take medication, just putting it on her table, not actually taking into thought that Nikki had a learning disability.
Nikki was repeatedly taken to Barnet General Hospital in North London after she fell ill in September. Her family believes she died as a result of indifference by medical staff, which meant she was not fed properly. Her medication wasn't always administered adequately, and there was a delay in her diagnosis. The tragedy is that Nikki's case is not isolated. Channel 4 News has seen the interim results of a confidential inquiry into the premature deaths of people with a learning disability. They've found that 56% of the deaths fell into this category. That is, they died too soon. And the charity MenCap has also been collating their own evidence. Over the past decade, the number of cases described by them as death by indifference has continued to climb. From 2002 to February this year, there were 74 allegations. That has now risen to 85. The majority claim delays in treatment, lack of basic care and poor communication. Cases can take years to be investigated, but of the 25 deaths so far referred to the Health Ombudsman, 12 have been upheld and 2 are pending. In 2007, MenCap revealed the disturbing lack of care and even deaths of 6 patients. Since then, a number of reports have led to a number of recommendations, including the need for specialist nurses.
Some things are getting better. People are trying, but it's still so patchy. And we're seeing too many examples of people's care being substandard in a way that is because or aggravated by the fact that they have a learning disability, and indeed deaths that are probably preventable, where had people listened to them earlier, or those who care for them and support them, that death may well have been able to be prevented.
At St George's in South London, they have, through their learning disabilities nurse consultant, recognised that hospitals can be frightening, overwhelming places, and that staff don't always have time to listen properly.
We'll take people to a quieter part of A&E, and they're maybe with their carers, and they're frightened and scared of being in hospital. So what I've done here is, with one of the medical consultants, we've been together to assess the patient and do things, but I've requested that what we do is we take our time.
And patients are given these passports, which staff can immediately refer to and use to communicate with. Peter Cranham, though, recalls his first visit to the hospital and the terror of not knowing what was happening until Jim Blair came to find him.
Well, they took me around to X-ray, and they wasn't telling me anything, and they gave me some tablets, but I wasn't taking any medicines. Yeah, well, I kept refusing them till I saw Jim the next morning, and Jim explained to me what's going on.
This is an example of excellent practice, and there are other hospitals running similar schemes. But worryingly, in a recent survey, more than half of NHS nurses asked said that they had seen cuts to services for people with learning disabilities. The Care Minister, though, told us today that there needs to be a complete change of culture.
Would we ever tolerate someone with cancer being given the wrong care or treatment? No, we wouldn't. And we just have to be very clear from the centre throughout the whole system that inferior care or treatment for people with learning disabilities is completely unacceptable.
In Nikki Rawlinson's case, the hospital has apologised unreservedly and has now introduced more training for staff and the patient passport system. But the investigation is still continuing.
Well, treat people with learning disabilities the way they should be treated. It's not their fault they're like that. It wasn't Nikki's fault that she had a learning disability. Just give them a little bit more respect.
That was Victoria Macdonald reporting there.